Hello and welcome back to Dentrixtry. There's a wide variety of dental burrs in the market, with each one having specific function and advantages. But we are often confused with the selection of these burrs. Watch this video to know the list of burrs you need for your tooth preparation. First of all, you need to know that the burrs come in different diamond grit sizes and they are usually color coded. For tooth preparation, you can use the green band or the coarse burr for your reduction. However, in my opinion, the standard or the medium grit size works better as you have a better control over the aerator. This burr is either devoid of any color code or you may have a blue band on it. When it comes to finishing, the extra fine and the fine burrs are recommended, which has a red and a yellow band respectively. Now, since that is clear, we shall begin with the different types of burr needed for tooth preparation. First is the straight fissure bur. This can be used for creating depth orientation grooves and also for occlusal reduction. For the depth grooves placement, the straight fissure bur is used by sinking it to its full depth. And when it comes to occlusal reduction, all you have to do is follow the pre-existing cuspal inclines. This way you will end up with the desired anatomic reduction of the occlusal aspect of the tooth. So you can use it for occlusal reduction of any type of crown, whether it is a metal, PFM, PFZ, a lithium disilicate or a monolithic zirconia. Alternatively, you can use a tapered flat or a tapered round burr for the same. Next we come to the burr used for preparing the chamfer margins. This can be either a round-ended burr or a torpedo-shaped burr. A very important thing you need to remember is that these burrs are to be used by sinking only half the width of the burr while keeping them parallel to the long axis of the tooth. What happens if you end up sinking the entire depth of this diamond burr? A lip of unsupported enamel will be formed, just like we discussed in the previous video, which will ultimately compromise the fit of your prosthesis. Although both can be used for creating a chamfer margin, a round-ended burr is preferred over torpedo-shaped as the finish line created by the torpedo one is generally too shallow and insufficient. So according to me, the torpedo diamond if you're using should be restricted to only the metal crowns. The round-ended burr will create a deep chamfer margin which is needed for your monolithic zirconia, lithium disilicate, porcelain fused to zirconia, even for a metal and the metal collar on the lingual or the palatal margins of your PFM crown. So it's kind of a universal burr. Next we come to the tapered flat burr. So these diamond burrs feature a moderate taper. Keeping this burr parallel to the long axis of the tooth will give you the taper you require in your preparation. It can be used for preparing your axial, proximal, occlusal surfaces, including the depth cuts, but they're mainly used for preparing your shoulder margins. There is just one problem with these burrs, that it produces a sharp 90-degree internal line angle as you prepare. When that happens, the masticatory forces are concentrated here, which eventually ends up in chipping of your prosthesis or your tooth. To tackle this issue, we now have the modified shoulder burrs or the rounded shoulder burrs. These are the same as your regular tapered flat burr but with rounded edges. So this solves a problem automatically by creating a rounded internal line angle, thereby reducing the stress concentration at this vulnerable part of the preparation. This burr can be used by sinking the tip to its full depth, unlike which burr? The chamfer one, right? It is mainly used for your PFM crown, but it can also be used for your zirconia and lithium disilicate. Next we come to a very important pointed interdental burr, also known as the needle burr. As you can see, it is super thin. It is used for breaking the interproximal contacts when preparing the tooth for a crown. When using this burr, make sure that the burr is oriented parallel to the proximal tooth surface. Start by placing the burr above the interdental papilla on the buccal or labial aspect and then run it across the interproximal tooth structure. Moving on, we have the flame-shaped burr or the football-shaped burr or the wheel-shaped burr. These are used for your cingulum reduction on the palatal surface. It is used by positioning the burr such that its widest portion sits into the deepest concavity on the palatal or lingual aspect of the tooth being prepared. It is used for reduction of the lingual fossa when preparing the tooth for a porcelain fused to zirconia, a lithium disilicate or a PFM crown, especially for the incisors and the canines. Moving on, we have the end cutting burr, which is used for the finishing of the gingival margin. This burr has diamond particles incorporated only at its tip. The non-cutting shank of the burr allows it for it to be used on the proximal surface of the prepared tooth, without the fear of accidental damage to the adjacent teeth. It is mainly used for removing any irregular, unsupported tooth structure around the prepared margins. So in case you have an unsupported enamel lip formed on the gingival margin, you can use an end cutting burr to smoothen it out. Next we have the diamond-shaped burr. It is used to give an anatomy to a flat occlusal table, especially for a root canal treated tooth. We all say that a tooth preparation should look like the miniature of the original, which is achieved by following the cuspal inclines. But most of the times, the teeth that we are preparing are root canal treated, and the occlusal table is usually flat. So in such cases, this burr comes handy. All you have to do is run your burr from mesial to distal. This is the position of the burr you need to keep, and this is what you get. All you have to do is then round off the edges if any. Next, short shank burrs. This is used in difficult to access areas. You have to keep a set of these short shank burrs and also a mini head handpiece in your clinic. How many times have you encountered difficulty in the preparation of upper molars, especially the distal surfaces, or in patients with a limited mouth opening? This short shank burr along with your mini head handpiece is an extremely handy combination and will help you easily prepare teeth in areas which are difficult to access. Coming on to the finishing burrs, it is used to round off all the sharp line angles and point angles. Finishing can be done with a tungsten carbide burr or a fine diamond burr with a red or a yellow band. So you can have a set of these in the corresponding shapes mentioned above. The last thing that I would like to mention are the burrs used for sectioning of your tooth. So when it comes to metal, you need a tungsten carbide burr for sectioning of the metal crowns. For zirconia crowns, you can use these super coarse black band burrs. So this was all about the different types of burrs. You have many different sizes in the same type. It is always better to know the size of the burr and choose according to your preparation. It makes things easier for you. If you still have any questions regarding the sizes, please post it in the comment section below. I'll be happy to answer any queries you have. And don't forget to like, share and subscribe to the channel.